Good afternoon, ladies and gentlemen. I'll very briefly give you an EDCTP perspective on biopreparedness and related capacity development in Africa. As you all know, EDCTP is one of the Article 185 initiatives, in fact, the Pioneer 185 initiative. We are a public-public partnership with 14 European countries as full members, one aspirant country, that is Switzerland, and 14 full members from sub-Saharan Africa. Sorry. Yeah, our vision is really to contribute towards the social and economic burden of poverty-related diseases in sub-Saharan Africa. And we aim to contribute to the reduction of poverty in sub-Saharan Africa through improved health by funding collaborative research that enhances both research capacity and accelerates the development of new or improved medical interventions against these diseases. And this is built on 5 key pillars, and that is increasing new or improved medical interventions, increasing the cooperation with sub-Saharan Africa, and this is through building capacity in the areas for clinical trials, ethics and regulatory capacity, improving coordination, alignment, and where possible, integration of European national programs, increasing international cooperation with like-minded organizations, and increasing interaction with development partners. This includes both the EU and the WHO initiatives. We are doing all this with a results-based implementation strategy, and this is engraved in our, it's anchored in our key values. Just to highlight the key features of the EDCTP program, we've established ourselves as a flagship European-African partnership that is recognized internationally as a funder for clinical research in the area of poverty-related and neglected infectious diseases. We operate as a true partnership of equals, and that also is reflected in the membership of the countries that are full members of the program, although the funding is available to all sub-Saharan African countries. We are enhancing the capacity of sub-Saharan Africa to conduct clinical studies, but also this includes ethics and regulatory activities. The EDCTP2 program also encompasses target populations that are often excluded in clinical studies, but with major unmet medical needs, such as the very young children, pregnant mothers, patients with co-infections and comorbidities. These are included in the work that we fund. We fund the whole scale of all phases of clinical trials, phases 1 to 4, as I'll mention. And we've also expanded to include implementation research that is product-focused on delivery and uptake of medical research, which makes it even more relevant to health services in sub-Saharan African countries. We focus on clinical challenges and policy-relevant questions, ensuring the results of the research feeds back directly into the national and international policy making. And we are committed to working with like-minded partners, and that's why I'm here. Our disease scope covers HIV, AIDS, TB, and malaria. We extended it to cover neglected infectious diseases, diarrhea diseases, lower respiratory tract infections, especially in children. And now we include emerging and re-emerging infections of particular relevance to sub-Saharan Africa, such as Ebola and yellow fever. As I mentioned on the side of clinical studies that we support the whole from phases 1 to 4, including product-focused implementation research. And this also includes some of the low intervention clinical studies that involves diagnostics. Coming to the strategy, and this links up to our discussion this afternoon, as strategy for capacity strengthening in sub-Saharan Africa. First, on the side of site preparedness, this is an area where we make an investment in really strengthening site preparedness for conducting clinical studies. I must say, if you as part of the FAST program, which ran from 2003 to end of 2015, we worked with over 150 institutions in sub-Saharan Africa. And many of the countries that were able to contain and had very good surveillance systems around the Ebola affected areas are countries that had good capacity, even in the area of site preparedness. And that was part also of our contribution in these areas. We have a very comprehensive fellowship program, which I'll mention briefly. We strengthen ethics and regulatory capacity, and we have regional networks of excellence. We realize that there is we have sites that have different capacity for conducting clinical research across the African region. So as part of the first program, we supported establishment of regional networks of excellence, which supports a network of institutions that are able to provide and develop high-quality clinical trials capacity and also support upcoming institutions within the regions. And as part of the second program, we've relaunched this call, and we are going to support, again, 4 regional networks of excellence in the eastern, western, central, and southern region of Africa. And this also builds into preparedness. We provide strengthening for product-focused health research systems research in the areas of course, pragmatic studies, implementation research, and pharmacovigilance. All this, we do it in a very coordinated way, and we support clinical research integrated with capacity development and networking. And I'll not go into the detail of the different schemes that we have. This is just to give you a snapshot of that. But coming specifically to the area of preparedness, we've launched a call on research and clinical development of patients in poverty-related epidemics in sub-Saharan Africa. And this is really to help in supporting the establishment of a multidisciplinary consortium that is able to provide accelerated evidence for optimal clinical management of patients and for guiding public health response to any severe infectious outbreak caused by pathogens within the scope of EDCTP with pandemic potential. But I must say that this includes new pathogens that may come on board. This is the letter of intent. The deadline was today, and this is a 2-stage proposal, and we hope that this will be funded early next year. Really, this is, we also, to avoid duplication, we encourage collaboration with similar initiatives in this area, and also to ensure that there is capacity that is built for ensuring preparedness. And this will cover evaluation of potential preventive or therapeutic interventions, validation of diagnostics, and establishment of disease natural history and determinants of disease severity. And all other issues related to establishment of standardized protocols, definitions, strategies for optimal clinical patient management in any severe infectious outbreak. We've launched another call. We have projects that are running now in the Ebola-affected areas, and this is also on preparedness. We have another call which is on vaccines across poverty-related diseases, and of course this involves emerging infections as well. We have one that is on supporting strategic actions, supporting large-scale clinical trials. This particular call really calls for partnership, and this is where PDPs and other public partners come on board. We have a whole scale of coordination and support actions for strengthening ethics capacity, and also strengthening health systems where we address issues like pharmacovigilance. And we have a number of calls that are aimed at developing human capacity, ranging from career development fellowships, senior fellowship schemes, but also mentorship schemes where we have fellows that come from sub-Saharan Africa and get attached to any industry partners or PDPs to get rare skills to help them, especially in the regulatory type of clinical trials. I'll address more on the side of capacity gaps in the discussion. Thank you very much for your time.